It's now illegal in California for doctors to tell patients certain information about COVID-19. Anything contradictory to the consensus is banned. We discussed this with a doctor and author of Courage to Face COVID-19. Joining us now is Dr. Peter McCullough, an internist, cardiologist, epidemiologist, and leading expert on COVID-19 treatment. Great to have you on with us today, Dr. McCullough.
Thanks for having me.
Why is this California law targeting doctors who push so-called COVID misinformation so significant?
You know, AB 2098, just signed into law by Governor Gavin Newsom, it represents the largest threat we've ever seen against freedom of speech in the United States. This basically puts a muzzle on doctors who are trying to help patients with COVID-19. It declares misinformation, and I can tell you as a doctor that doesn't exist. There's simply evolving scientific data, hundreds of thousands of scientific reports. It's a novel coronavirus, and there's always two or more interpretive points of view. Doctors deal with scientific data. There's no place for the medical board to claim information or misinformation.
So now the law claims to crack down on misinformation, such as questioning the effectiveness of masks and vaccines, with one sponsor of the bill basically saying this will help preserve public trust in the medical profession and protect patients. In your view, are those measures effective, and should medical professionals be allowed to question them?
Well, there's emerging sources of scientific data. Let's take masks. There have been 12 randomized trials in respiratory diseases, 2 in COVID-19. They failed to show that public masking had a benefit. Now, recently, the CDC has just released its guidance saying even in healthcare facilities, masking isn't needed unless we're directly dealing with COVID.
I see. And now the law has just been signed by the governor. Why now? How prevalent is COVID in the U.S. at present?
COVID's on the way down. You know, we're finishing this after wave of the Omicron, the big Omicron spike in December, January. Then we've had this after wave. It's mutated to a very mild form. The hospitals are essentially empty of severe cases. There are deaths being recorded, mainly in patients who have coincident COVID positivity. One remains positive for COVID for many months after the initial illness. So if someone's hospitalized for another reason, still being counted as a COVID case. But I can tell you clinically, I do have some patients in my practice. It's easily treated at home with multi-drug approaches, and there is essentially a negligible threat for hospitalization and death. So this bill is oddly timed. It's unconstitutional. I think it's going to hurt COVID-19 care in California. Doctors are going to naturally recoil and not take risks.
Speaking of the constitutionality of the bill, Californians for Good Governance oppose the law, saying it contains unconstitutional restrictions on free speech. What's your reaction to this?
You know, I think they're on the right track, and leading really internationally known child psychiatrist Mark McDonald and family physician Jeff Barkey just filed a lawsuit against California and AB 298 with the Liberty Justice Center. So there's going to be a mountain of legal work to kill this before it gets going.
We'll see how these legal challenges play out. Now, Dr. McCullough, what do you think Americans need to know about COVID right now?
I think the most important thing is everybody needs to know their status. If someone's already had COVID, the next illness with COVID is going to be mild and a negligible threat to them. So every employer, every person, every school, if they're going to keep track of anything, it's not a vaccine. It's actually be whether or not someone developed COVID-19 respiratory illness. Paper by Kimatelli and colleagues shows that if one's already had the illness, they have a negligible risk for severe outcomes with the second case. The second case is going to be like a common cold.
Very good to know. Well, COVID-19 treatment expert Dr. Peter McCullough, pleasure speaking with you today.
Thank you.